Hello, everyone. It's Friday, March the 25th, and before we get into all the COVID stuff and everything, you know, we surely will honor all these great people we've lost. In fact, I'm gonna change up. I'm gonna do it that way, right? You know, there's nothing that we could be more respectful of, in my opinion, than the fact that we've lost another 88 people in West Virginia. That's 6,739 great West Virginians that we've lost. And so I ask all the time that you join me in prayer, and Kathy as well, for all these people, all their families, all their loved ones and everything, because we're not going to let them be a number. We're just not going to let that happen. We're going to read every single person that we've lost, and absolutely we're not going to let them be a number. You know, the 6,052nd person to die in West Virginia is a 90-year-old female from Berkeley County. The 6,053rd person to die is a 60-year-old female from Berkeley County. I'm going to start all over. The 6,652nd person is a 90-year-old female from Berkeley County. The 6,653rd is a 60-year-old female from Berkeley County. The 6,654th is a 91-year-old male from Putnam County. The 6,655th is an 82-year-old male from Taylor County. The 6,656th is a 63-year-old male from Kanawha County. The 6,657th is a 58-year-old female from Berkeley County. The 6,658th is an 80-year-old female from Kanawha County. The 6,659th is a 90-year-old male from Raleigh County. The 6,660th is an 89-year-old female from Harrison County. The 6,661st is an 84-year-old male from Raleigh County. The 6,662nd is a 55-year-old female from Marion County. The 6,663rd is a 56-year-old male from Upshur County. The 6,664th is a 69-year-old male from Putnam County. The 6,665th is a 72-year-old female from Kanawha County. The 6,666th is a 90-year-old female from Kanawha County. The 6,667th is a 73-year-old male from Harrison County. The 6,668th is an 81-year-old female from Wood County. The 6,669th is an 81-year-old male from Marshall County. The 6,670th is a 77-year-old female from Raleigh County. The 6,671st is a 74-year-old male from Randolph County. The 6,672nd is a 99-year-old female from Kanawha County. The 6,673rd is a 42-year-old female from Putnam County. The 6,674th is a 78-year-old female from Fayette County. The 6,675th is a 66-year-old male from Kanawha County. The 6,676th is a 54-year-old male from Monroe County. The 6,677th is a 94-year-old male from Tucker County. Now it's all terrible, and it's all sad. But this right here just takes your breath in my book. The 6,678th is a 29-year-old male from Berkeley County. The 6,679th is an 83-year-old male from Kanawha County. The 6,680th is a 79-year-old female from Tucker County. The 6,681st is a 67-year-old female from Taylor County. The 6,682nd is a 73-year-old male from Mercer County. The 6,683rd is an 80-year-old male from Fayette County. The 6,684th is a 75-year-old female from Hampshire County. The 6,685th is an 88-year-old female from Kanawha County. The 6,686th is a 59-year-old male from Fayette County. The 6,687th is a 90-year-old male from Mercer County. The 6,688th is a 94-year-old female from Wyoming County. The 6,689th is a 56-year-old female from Putnam County. The 6,690th is a 94-year-old male from Barber County. The 6,691st is a 63-year-old male from Cabell County. The 6,692nd is a 72-year-old female from Cabell County. The 6,693rd is a 94-year-old male from Ohio County. The 6,694th is a 41-year-old female from Raleigh County. The 6,695th is an 87-year-old male from Berkeley County. The 6,696th is a 79-year-old male from Putnam County. The 6,697th is a 70-year-old male from Wayne County. The 6,698th is a 69-year-old male from Cabell County. The 6,699th is a 96-year-old male from Ohio County. The 6,700th death in West Virginia, gosh, it's awful, it's so sad, is a 91-year-old male from Monroe County. The 6,701st death is a 74-year-old female from Wayne County. The 6,702nd death, a 66-year-old female from Summers County. The 6,703rd death, a 62-year-old male from Ohio County. The 6,704th death is a 68-year-old female from Ohio County. The 6,705th death is an 80-year-old male from Harrison County. The 6,706th death, an 88-year-old female from Wood County. The 6,707th death, a 77-year-old male from Jefferson County. The 6,708th death, a 67-year-old male from Preston County. The 6,709th death, an 86-year-old female from Mercer County. The 6,710th death, a 61-year-old male from Greenbrier County. The 6,711th death, a 72-year-old male from Raleigh County. The 6,712th death, an 81-year-old male from Webster County. The 6,713th death, a 90-year-old female from Preston County. The 6,714th death, a 55-year-old female from McDowell County. The 6,715th death, a 53-year-old female from Berkeley County. The 6,716th death, an 88-year-old male from Ohio County. The 6,717th death, a 70-year-old male from McDowell County. The 6,718th death, a 61-year-old male from Ohio County. The 6,719th death, a 70-year-old male from Lincoln County. The 6,720th death, an 85-year-old male from Ritchie County. The 6,721st death, a 68-year-old male from Marion County. The 6,722nd death, an 83-year-old female from Raleigh County. The 6,723rd death, a 70-year-old male from Upshur County. The 6,724th death, a 61-year-old male from Preston County. The 6,725th death, a 91-year-old female from Ohio County. The 6,726th death, a 64-year-old male from Randolph County. The 6,727th death, a 56-year-old male from Kanawha County. The 6,728th death, a 90-year-old male from Wood County. The 6,729th death, an 84-year-old male from Wetzel County. The 6,730th death, an 82-year-old female from Kanawha County. The 6,731st death, a 77-year-old male from Marion County. The 6,732nd death, a 62-year-old male from Boone County. The 6,733rd death, a 78-year-old female from Mercer County. The 6,734th death, a 49-year-old male from Wyoming County. The 6,735th death, a 63-year-old female from Wyoming County. The 6,736th death, a 91-year-old female from Kanawha County. The 6,737th death, a 54-year-old female, the 6,737th death, a 54-year-old male from Raleigh County. The 6,738th death, a 53-year-old female from Mineral County. And the 6,739th death in West Virginia is a 48-year-old male from Fayette County. Please, 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 absolutely, if you would, please keep all these folks in your prayers. We have a lot of good stuff to report, but the good stuff's not going to help these people. And we don't want more to die. I'm going to tell you in a minute exactly what I've told you 15,000 times, and that is just this. The vaccines work, and the vaccines are safe. Absolutely, if you're vaccinated, get your booster shots. Without any question, absolutely, you should get your booster shot. You know, we're not through with this. It's going our way, and we're so delighted that it's going our way, and the sun's shining, and it's springtime, and absolutely right behind that is going to be summer. We want our kids especially to have a wonderful, wonderful summer. And this last 2 years has been really tough on them, I'm sure on you as parents, and absolutely on all of us. We're better. We're better. But for the 6,739 that we've lost, you know, it didn't matter. It doesn't matter to them. It doesn't matter to their loved ones. We've lost them. We don't want to lose more. And you're going to have to listen to me. You're going to have to please, please follow up on your booster shots especially. You know, this thing is not over. I don't know how long it will last. You know, odds are that the pandemic, from what we know, 2 years is the life cycle, and we're very hopeful that that's going to be the case. But we've never dealt with anything like this. We haven't had a playbook. We don't really know exactly what we should do or couldn't do, you know, or you know, along the way, you know, what exact buttons to push. We said a lot of prayers. And by God above, we've pushed the right buttons. But now you got to help me. You got to continue to help me. You'll see in just a second those that are over 65 years of age that have gotten at least one shot now is 90.2%. It's great. And we continue to slowly, slowly move up. But don't forget to get those booster shots. Please don't forget to do that. The active cases in the last 24 hours are 460. You know, at one time this was off the chart. I take that back. The active cases that we have are 460. The new positive cases in the last 24 hours are 119. You know, at one time, I think we had close to 30,000 active cases. The daily positivity rate is at 1.74. That's good. Our cumulative rate continues to fall. It's at 8.26. We have recovered cases in the state of West Virginia today, 490,031 total cases that are recovered. We have 171 people that are hospitalized, with 43 in the ICU units and 26 on ventilators. And for the first time in who knows how long, our entire map in the state of West Virginia is green. Focus on that in just a second, West Virginia. I mean, you've been to you know where and back. We all have. Focus on that. We all said we're going to keep heading north. And as we were continuing to head north, along the way, we lost a lot of people. A lot of people fell to the wayside, and we lost them. We pulled the rope together, and now we're all green. We got to keep on walking, and we got to keep on trying to get everybody across the finish line. This will leave, and we'll beat it. And I will promise you to God above, if you're vaccinated and you happen to get this, life will be probably much, much, much easier and much better. I'm absolute testimony to that. You know, really and truly, I'm surely over 65 years of age and surely carrying around some extra weight. And with all of that, boom, I'm fully vaccinated, got the booster shot and everything, and I've got COVID. The first couple of days were really bad. Really, really bad. But then after that, got well very, very quickly, and I was right back with you. Now, without these vaccines and without that booster shot, it could have been really, really, really bad. I know that. I know that. So I would tell you absolutely again and again and again, to God above, get the vaccines. Please get the vaccines. Dr. Marsh announced, you know, a new vaccine calculator that basically tells you when you're supposed to follow up with your booster shot. We discussed that the other day. You know, I've gone over all the booster shot information I could possibly tell you. I've told you about our numbers as far as our distribution, our vaccine distribution update and everything. Like I said, we slowly keep getting better. All of our information on our vaccine info line is up, and we've got, all that you can, just go to our website and get. I remind you about the free testing, to continue to take advantage of that if you have any symptom whatsoever. We have 59 outbreaks in our long-term care facilities. Listen to these numbers. One time that was well over 100. We have no outbreaks in our church community. That's great. Get this number. We have only 18 inmate cases. We were above 1,000, I think. We have 3 staff cases and 18 inmate cases in our corrections. And I really, just salute and give many accolades to all the great people in corrections. Now, just some announcements. The rental assistance program is still available for anybody that's a renter or a landlord. But there's a new program now, a brand new program out. If you own a home, these are for homeowners, and you have had issues. There are caps on income, but the caps on income are very liberal and very high. And with that, you can qualify for real dollars here. So any homeowner that we have in West Virginia, please get in touch with us. This program will start next Monday, March the 28th. And this is good stuff right here. That's all there is to it. The program can provide assistance for past due mortgage payments up to $15,000, past due utilities up to $2,500, past due insurance, property tax payments, or other housing costs up to $5,000 and even more. You got to get a hold of us, because really and truly, this money that's flowing into them from the federal government, if we qualify you and you can get these monies, it just makes things easier for you and better for you in times that were really tough. But in addition to that, it puts into our economy multiplier effect dollars that will really help us. So nevertheless, get in touch with us. I remind you about giving blood. Check with your physician and everything, and please consider, because especially if you've recovered from this, because it's a gift of God that you recovered and everything, and I remind you about giving blood. From the standpoint of our job jumpstart program, we've got that up and going now. We kind of copied what happened or what Oklahoma was doing, and this is getting more people back into the workforce. Our employers need them, and need them really badly and everything, and we can get you a check, a little incentive check for $1,500 if we can get you on a job for 8 weeks or more. Let me put that last. We had our Jobs and Hopes graduation the other day, and this was at the Civic Center, and I just see right there that Baby Dog joined us on that day, and she spilled water all over the place. That's her water bowl that she had, down there, but she was really proud of the graduates. I was super, super proud. These people have done amazing, amazing stuff. And what I said over there was just this. Employers, hire them. These people have taken a step forward that is unbelievable when it really boils right down to it. They have not only become trained, and they have not only received treatment for their problems and everything, but they did something that is absolutely the most difficult for people to do to get better at anything in life. They stepped forward and said, I'm messing up. I'm doing something wrong and everything. How many people do you know that is the key to getting better? And if I've ever given you any wisdom, that's it right there. The whole key to get better at anything, being a ball player, being a person in a business situation, stuff in your family, every single thing. The whole key to getting better is one thing. You got to first admit you're doing something wrong. Absolutely. When we get saved in the church, what do? we walk up and say, I'm messing up. And instantaneously, things start to get better. It's the very thing you got to do in life. And you got to do it in everything we do. These people have done just that. They've stepped up and said, I'm messing up, and I absolutely want to get better. And they've done that. And now they've become trained. And absolutely, I think there's 1,580 that we've gotten through this program right now. But in addition to 1,580, we've got 1,600 that are in the program today. This program is tremendously successful. We thank all those, whether it be Laurie or Deb or all the different people that have really put in the licks to make all this happen. But I truly encourage our employers to take advantage and hire these people. These people absolutely will do you a great job. Really proud of all of them. Really, really proud. We lost an absolute patriot in Madeleine Albright. A lady that became our first, Secretary of State, from the standpoint of female first Secretary of State. She passed away just a few days ago, and we will lower our flags, on Sunday, March the 27th. I never met her, but really and truly, I saw her over and over work and do great, great, great stuff. But our flags will be lowered from today until Sunday. So I had the opportunity to meet President Clinton several times and everything, but I didn't get to meet, our Secretary of State, Madeleine Albright. But please keep her in your prayers. Okay. We got a basketball team. A women's basketball team. It's been ranked number one the entire season for all practical purposes in the entire nation. They're going to be playing tonight, and they're playing Western Washington at 8 p.m. in Birmingham tonight. You can watch the game on CBS Sports Network. And absolutely, this team is 34-1 at this point in time. They are playing for our national championship. Now, I want to just say one thing real quick. I had a little kid that played for me, a beautiful young lady. Her name's Autumn Hill. And Autumn is at Glenville State, and she was planning to play basketball there. And then she had some health issues, and she wasn't able to do that. And I know she wishes like crazy that she was with the team, and, from the standpoint of possibly being able to participate as well. But I'm promising you this, that Coach Stevens and this incredible school, Glenville State, new president, Mark Manchin, absolutely, this incredible school is doing greatness and making West Virginia proud. I want all of you to know that I'd be there. I'd be there tonight in a millisecond. But in all honesty, with what I got going on with this hip, it's tough to do. It's really tough to do. So I'm going to watch from home and scream at the television in every way, and hopefully we can bring the Lady Pioneers through and bring us a national championship. It is really, really, really special. So congratulations, team, and y'all all tune in as well. And let's all get them across the finish line. I've got one more announcement here that Donald A. Nickerson Jr. of Wheeling that I appointed to the Intermediate Court of Appeals. It's getting, we're getting teed up and getting ready to go, and for whatever concerns, that he may have and everything, that it just is not fitting with the job responsibilities and the family and everything, he's decided to pass, and he's offered up his resignation, and we'll have to make another appointment for that position, and we'll do that right away. But we thank him for his consideration, and thank him for all the good work that I know that Donald does all the time. He's a heck of a man, and he does great work. So thank you. Okay. I've got just three other things here real quick, but I just want to go to I want to tell you this. We just got through. You know, Kathy came down today. Like I said, she's I don't know if I mentioned it to you guys here on this, but Communities in Schools is doing phenomenal work, and they've grown into 30 plus counties, and they're wanting to get in every county in the state, and it is amazing. You know, I've said it over and over, and I don't say this because of Kathy in any way, but you know, I've seen lots of programs. I'm in and out of the schools all the time. You know, I love the kids beyond good sense, and I absolutely just love all the good stuff that we're trying to do within our schools. One of the very first things that I said in my first State of the State address is we need to make education our centerpiece. We're trying, and we've made incredible improvement. And all of a sudden, the outside world, instead of looking at West Virginia saying West Virginia is backward or poor, dingy, or whatever it may be, now all of a sudden we become the diamond in the rough, and everybody's saying, "Oh my, we want to come to West Virginia and everything." Well, we want to continue to make our schools better and better and better, and help our students, help our teachers, help our service personnel, all that, you know. But in all that, Communities in Schools is doing a project with therapy dogs, and so if you'll tune in today at 12:30, you know, the First Lady and I are going to announce something really special in regard to therapy dogs in schools and everything. We know it works. We've seen it in the past. We've got very few schools in West Virginia that have a therapy dog there, but it is beneficial to the kids, I'm sure to the teachers and service personnel people as well. But if you'll tune in at 12:30, I think you'll see some nice stuff that's going on right there. From the standpoint of the bill signings, let me go back to that in just one second. Today we signed a couple bills that primarily were done. You know, I addressed it in my State of the State. I asked for the consideration of those bills. I sent the bills up there. We went through all that and everything. It was all designed around one thing, and that's special need kids that were being abused. And it is so just bizarre. It's unbelievable. You know, there's been horrific acts, you know, in regard to our special needs kids. You know, these are our gifts. These are sent from God to us. And absolutely they need our protection. You know, there's a couple bills passed. One of them basically said that there's going to be video cameras, not going to be maybe. There's going to be video cameras in all the special needs classes, you know, and with all of that, you know, they're going to be accessible at all times, and make it to where absolutely we just do not have another horrific act happen to one of our, like I said, gifts from God. And so with all that, you know, we were able to sign a couple bills and do that bill signing with all these great kids around us and their parents and loved ones, and with all that, in addition, excuse me. In addition to that, the second bill basically made it a felony that if anybody, you know, abuses or batters or knows of something that has happened and they did not report it, now it's a felony. And so we've really stiffened it up and made it really tougher, and hopefully that will get the word across that we just can't have that ever happen. And it is an exception beyond belief. We all know that the special ed classes are taught and the aides and all the people that are there, for the most part, are 1,000% the greatest of the greatest. We cannot afford one mistake. We cannot afford that. That's all there is to it. And so, you know, I don't think we'll ever have another mistake, but we cannot afford it or we cannot tolerate it. These kids absolutely expect us to stand up and protect them in every way. This is not a slight in any way at the great, great, great teachers and all the great work that's done every single day, every single solitary day. But there are situations to where really, you know, bad things can happen, and we absolutely have to ensure that they're not going to happen to our kids. That's all there is to it. let me even go back a little further. From the standpoint, I'm not going to go through every little bit of this, but you know, I have thousands of pictures that have been taken of me in situations or with different people being the governor. I've had lots and lots and lots of pictures taken. This was taken by someone, I think, in my office and everything, and then we got the picture and everything, and I want to show it to you in just a second. You know, I bring Baby Dog every day that I can and everything from the standpoint that people want to see her and all that, but she just can't go all the time because she just gets too tired. But nevertheless, I had her this day, and she was sitting in a chair beside me. And someone took a picture that I regard at this moment as the best picture that has ever been taken of me being the governor since I've been here. This was kids. These were Down syndrome kids, and the bills we were signing basically were to assure that discrimination would not be taking place in regard to abortion or in regard to organ donation or whatever. But they were there. And I always say this, but you know, I had a great athletic director one time tell me, kids know if you like them. Well, these kids especially, but all kids know, I love them to death. And so they were all coming up and hugging me, and I was hugging them and everything. And Baby Dog was just sitting beside him. And this beautiful little kid came in. I think her name is Anna. I'm not sure. But nevertheless, she was coming. She came up and just gave me his biggest hug and everything. And then Baby Dog leaned over and was giving her a hug as well. But, you know, that to me could be the best picture that has ever been taken of me, or at least I feel that. Because that kid is truly just what it's all about. A gift from God. And so all of a sudden out of the clear blue nowhere, you got Baby Dog and I both, you know, and with absolutely one of our true gifts. So a great, great picture. Let me see. I've got two more things real quick. One is we went to Babcock earlier this week, and we kicked off Gold Rush. It was the 5th year that we've done that. And, you know, there I'm sitting. I've got my fly rod right in front of me and nets that I always have and everything. But that fly rod is a bamboo fly rod, and I've had it forever and a day. When I could really get around, it was really neat to have and all that. But nevertheless, I still enjoy fishing, and I try to go as much as I possibly can. There I'm probably a long ways from the stream, but believe me or not, I can still throw that fly rod. And but with all that being said, let me tell you what we did, and this is really, really meaningful to me. But Babcock, I truly believe, not to take anything away from any stream in West Virginia, because I love them all. Our state is full of beauty like nobody's business. That's all there is to it. But the lower end of Babcock, below those cabins, from there to New River, you know, has always been a dream. I've been down there fishing over and over and over and over. Didn't catch many trout. Caught a lot of little suckers and different things like that down there. But I was there because of the beauty. The beauty is just blows you away. That's all there is to it. And so what we're going to do in order for, to create more tourism traffic in this state, now with the New River, our national park, with the newest national park in the country, on our New River National Park, what we're going to do is we're going to now fix the road. The road's already there, but fix the road from the cabins all the way to New River. That's almost 5 miles to where we can get a stock truck up and down that road. And we can actually fill that stream full of fish like you can't imagine. And then we're going to promote it. We're going to advertise it and promote it and everything in hopes to bring in anglers from all over the nation or all over maybe the world. I am telling you, to Jim Justice, it's the most beautiful trout stream I've ever been on in my life. And that's down on that's about 9/10 of a mile down from the cabins right there. You can't see how big the stream is, but the stream truly is unbelievable, with holes that are probably 8 or 10 foot deep coming across rocks that are as big as your house and everything. And I even think, that people, when the water, early spring, I guess when the water really, we get a little bit higher waters, there's people that kayak from there all the way down to New River. It absolutely will become an attraction in West Virginia like you can't imagine. It is absolutely beautiful beyond belief. And the last thing I've got is Baby Dog is now in fourth place in our pool here, and she's still got a shot at doing the whole thing and winning the whole thing because she picked Houston along the way, and Houston's got a heck of a basketball team. But I'm telling you, Baby Dog's on it. The only last thing, I've got one last thing. We had an angler. His name is Lucas King. On March the 19th, now you just imagine catching a fish like this. He just caught a fish. He's from Burnsville, West Virginia, and he caught a muskie that with the old record, I'm sorry, he caught a muskie that was 55.06 inches long. It weighed 51 pounds. Look at that fish. And absolutely, it is our new state record in West Virginia. And absolutely, what a fish. I mean, he caught it from the bank of the Little Kanawha River. And absolutely, without any question, Lucas King, we're proud of you. But let me tell you what else he did. Absolutely, after we got all the measurements and stuff done, they released the fish back in the river. So that fish is getting bigger and getting bigger and bigger and will become a new state record someday. So absolutely, I congratulate Lucas, and I congratulate you on releasing the fish back in the river, and it's just an accomplishment like nobody's business. That is really big time in my book. That's all I got today. Thank y'all.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. As the governor said very well, that we are continuing to see a reduction in the number of cases and hospitalizations in West Virginia, and that is certainly cause for celebration. And what we do well as West Virginians is we rally together to make sure that we support each other. And as we start to look into the future, we want to make sure that we remain in this really good position from the COVID perspective. And what's clear as we look across the world and research that's coming out of the United Kingdom and Denmark and others, Israel, suggests a couple things. So number one is that as the second variant of Omicron, the BA.2 variant, continues to grow. It's now 35% of the total cases in the US, but it's a much higher percent of new cases that we're seeing today. So it does suggest that over a period of time, the BA.2 variant will become the dominant variant, not only in the US and in West Virginia. We know that people that have not been boosted or that have been boosted over 6 months ago start to lose some of the protection against this variant. So it's really important that if you haven't been vaccinated, now's a time to get vaccinated. And as the governor said, we have just released the vaccine calculator that will tell you if you're due to get another dose and will allow you to schedule that right on that site. But if you have been vaccinated and haven't been boosted, it's really important with the Omicron variant to get boosted, because it turns out that that booster is really effective in reducing the most severe complications of this Omicron BA.2 variant. If you've been over 6 months, that's something that the drug manufacturers from Pfizer and Moderna have asked the FDA to look at, because we know that 6 months after your booster, then the potency for the protection starts to reduce some. And although you're still reasonably well protected against severe complications, that's really the case for having another booster, which I'm presuming that we will consider in the next couple months here in the United States, particularly for older citizens. We know that the BA.2 variant in the United Kingdom has caused a really significant increase in cases. They were in the same enviable position that we are right now. And starting in early March, they started to see a rise in cases, a rise in hospitalizations, a rise in people on ventilators, and a rise in deaths. And they are a more heavily vaccinated and boosted population than we have in the US or that we have in West Virginia. So really important for you to consider to get the boost if you haven't been boosted, and certainly get vaccinated if you haven't been vaccinated. In work from Denmark, we also know that not having the booster had played an important role in allowing people to get infected with the BA.2 variant, and that's particularly true for older people in Denmark. And lastly, the fourth vaccine dose in Israel provided persistent protection against severe disease for 9 weeks after the vaccine was given with the BA.2 variant. So all in all, we're doing well, but we do see that there is a potential storm on the horizon with the BA.2 variant, and now is the time to prepare yourself and your family members to be protected by being fully vaccinated and boosted. And if you've been boosted for greater than 6 months, then it's also an opportunity for us to continue, or for you to continue to pay close attention with us about when another booster shot might be available, because I do believe that will be coming in the not too distant future. Thank you.
Thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. A couple of quick updates. As Dr. Marsh pointed out, vaccines and boosters are still important, and the task force continues to manage those while the pace of both first doses and boosters has slowed dramatically. There are West Virginians still getting those doses, and we continue to work to manage those, as well as helping to manage therapeutics that are needed for those who are still contracting the virus. In addition to that, the governor's tasked us to do a couple of things going forward. One is to continue to do due diligence and to do a follow-up exercise on what would be needed should we have a significant surge of the Omicron 2 variant. So we'll be working that over the next several days. And in addition to that, he's tasked us to, along with Dr. Marsh, Dr. Amjad, and I, to look at how we take the lessons learned from the way we have managed the pandemic under his guidance as a task force, and look at how we can apply lessons learned from those activities to look at improving the broader health outcomes for the people of the state of West Virginia. So we will be working on that as well. And last thing I just leave folks with as a point of reference, the governor read up to today the 6,739th West Virginian that we've lost. Just to put that in perspective from a military history standpoint, World War II, there were over 218,000 West Virginians that served in combat operations. In the entirety of World War II, we lost 5,830 West Virginians in combat operations in World War II. Almost 1,000 more people now have died from COVID in a shorter period of time. Thank you.
Thank you, sir. Dr. Ayn Amjad, our State Health Officer, is also joining us today and is available for questions. Secretary Bill Crouch had a prior engagement and will rejoin us next week. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Thanks for taking a moment. Governor, I was wondering if you could clarify. I spoke with some people associated with the program, and the renters program, you mentioned landlords, but I believe that only renters themselves can apply in that through the federal guidelines. Landlords can work with their renters to encourage them to apply, but the renter themselves must. So there might be some confusion out there. Landlords can actually take that step. They can work with their renters to do that. Is that something that you guys can clarify for me to make sure that I'm correct on that? Because when you say landlords and renters, that is true. They can work together, but I believe only renters can apply.
Kenny, I need to get some more information, but I'll get it before we're done here. And it may be that you're correct, but as I understood it, the landlords could apply, but I'll check with Erica Balgus and just double check the whole thing. But I've been saying all along that we want the landlords to call us and everything. And you may have something there that I don't have, but before we get done here, I'll come back and tell you, okay? Thank you.
All right, thank you, Kenny. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. I was wondering if we could get an update on our 12 BA.2 patients, if we know how those folks are doing. And is there any information you all could share about their vaccination status? Do we know if these folks were vaccinated and boosted? Thank you.
Dr. Marsh or Dr. Amjad, one of y'all please take this.
And I'll defer this one to you if you have information.
Sure, yes, Governor. Charles, right now our state data only tells us that we had about 12 patients with the BA.2 variant in West Virginia. I don't have any more information of whether or not they've been hospitalized or anything about their vaccination status. What we do know about the BA.2 variant, though, is that most people are not hospitalized with it. And of course, if you had your vaccines, you're unlikely to be hospitalized with that. But we don't have any more, private information on those individuals right now. Thanks.
All right, thank you, Charles. Governor, I'll turn it back to you.
Well, I didn't expect you to come back to me that quick, but nevertheless, I'll wrap up with my best here. Again, we want to congratulate Glenville, 150 years old. This is their 150th anniversary right now. Just in the past weeks, Glenville, we announced Glenville College, that is now becoming is now Glenville University. From the stand, Kenny, I promised, that I'd, give you an answer back, on the rental assistance program. We don't have that back yet. They just gave me a note that said that we'll have to get that to you next week because evidently they can't get a hold of Erica, the answer back, but so I don't have that back. But again, we congratulate Glenville. It is tragic beyond belief that we've lost another 88 people in West Virginia. But it's been a few days since we've had our briefing and everything, and this is probably just true up. In fact, there was 47 reconciliations here. We have an entire state now that every county is green, which is fantastic and everything. And I do believe that we're pulling away from this pandemic, but at the same time, you just heard our great General Hoyer, and you just heard Dr. Clay Marsh tell us that this Omicron 2 variant, is now rising substantially in the amount of in the people that are becoming infected again. Look, I don't know how to make it any simpler. You can become a statistic. We don't want anybody to be a statistic, but when you die, when you get really, really, really sick in the hospital, basically in ways that we don't want, you are becoming a victim of something that you can really do something about right now. If this Omicron 2 variant becomes the real deal, and everything, and it becomes that real deal, as we're seeing it already, there'll be more people get sick and there'll be more people die. Your chances of getting sick, absolutely without any question, are diminished unbelievably. Your chances of going to the hospital diminished unbelievably. And chances of death absolutely are so much lower, it's off the chart if you get vaccinated, if you get your booster shot. Kenny, they have come back to me and says that landlords, you're correct, landlords cannot apply without the permission, I guess, without the tenant being involved. And so, you know, you were right about that, and that is clarification. I'm glad, you know, that we're able to be able to get out to everyone. I've been pushing like crazy for the landlords to apply, and technically they can, but they can't apply unless they have the approval of the tenant. So Eric will be on the next time and answer any further questions along those lines. But that's a good pickup and a good clarification. Thank you for doing that. But nevertheless, all I got is the last thing is this: tune in here in just a few minutes, you know, and watch communities and schools do something really special with therapy dogs for kids. We've had a couple of incredible bill signings, and there's more than just 2 bill signings there with kids that we're trying to protect and look after in this state, and I'm really, really proud. It really just renews my heart in every way to be with those kids and everything. I truly believe they're gifts, and they're gifts from God, as all children are for all of us, and we should always remember that. So good day today on the bill signings, and tough day from the standpoint we lost 88 more people. Please keep them in your prayers. Good West Virginians. We're going to get through this, though, West Virginia. We're all green right now. We want to stay that way and just keep pulling this rope together. Thank you so much.